I'm Helen Heltston. I work at North East Links Council in the Insights team, and I'm a research and engagement advisor. So I've been working with Craig and Amy on West Marsh Community Plan, which is what we'll be chatting to you about today when the presentation begins.
Hello, I'm Craig, and I'm the community lead for the West Marsh Community Plan. And until just recently, I was one of the directors at Grimsby and Bloom, so I have a background in the community work.
Brilliant. And most of you know me, but I'm Amy Quickfall. I work for the Health and Care Partnership as the Engagement and Projects Manager, and I've had the privilege of working alongside Craig and Helen to get to where we've got to for the West Marsh Community Plan. So I've just started to share my screen. I hope everybody can see that, and we'll just go into it. So here we go.
So yeah, hello, as I said, I'm Craig, and I'm the community lead for the West Marsh Community Plan. My role is all about bringing residents, partners and organisations together to shape the long-term changes in the area. My background is in mental health and community work, and everything I do has been focused to make the West Marsh safer, greener and more connected.
Yeah, and as the bit at the top says, the biggest thing is around supporting Craig in the engagement with residents. Obviously, Craig is a local West Marshian, so has those connections that we needed to make the most of, and so that they were telling us exactly what was going on for them. Once the engagement phase had been completed and continues, we then move on around the analysis, reporting and sharing those findings, and the links with NELC is about making sure that the right people know what's going on and how we can make some of those changes bigger than just West Marsh as well, and how it can all link up together.
So my role and what I do is we explore the barriers, and we want to understand the barriers for people trying to access healthcare. What might they be? And look at the person and their journey and how environment, work and community impacts on your mental health and your physical health. I slipped into my Navigo hat then, didn't I? I went mental health, but it's your physical health and your mental health. So we champion community voices through the plan. We support Craig and give a lot of support to different community and join community partners together through this work. And, you know, we're here to create a community plan that's owned by the community, and one that could lead to further funding, raise profiles of issues and positive issues as well, and to share that connection between all the other parts of North East Lincolnshire. Helen, I think this is you, isn't it? Helen?
No, I'm life expectancy next.
Oh,
it was
right, okay, so
definitely not me.
Is this you? So I'll just, it doesn't matter. So yeah, so the West Marsh Forward was selected as the lead organisation because the West Marsh Forward brings together other partners across the West Marsh, and we felt like connecting into the West Marsh Forward was a way of connecting into the community. And it's followed a similar approach to the East Marsh. We've been looking to build on good practices and to learn what can be done differently. And there is some nuances and differences between both of the communities. And the plan's aim is to draw attention to the issues, which we'll talk about in a moment, and to raise awareness of them, but to collaborate across council, healthcare, transport, immigrate, you know, all these different big issues that kind of impact on a community. So it's there to highlight these issues for the people of the West Marsh.
So the West Marsh is home to around 7,500 people. It's a community with a lot of strengths, but also some big challenges, from housing and health outcomes to transport and safety. We have a younger than average population, and also a large number of privately rented homes. And life expectancy here is significantly lower than other parts of the town, which really shows why a community-led approach will matter.
So Craig's just touched there on life expectancy. This is talking about healthy life expectancy, and we've spoken about this in some other meetings as well. And this is something that's drastically getting worse in our area, which is why it's highlighted. So this healthy life expectancy is around the age at which you're going to live in good health for. The key takeaway here is that there's a 15-year gap between West Marsh and other more affluent areas just within Northeast Lincolnshire, and 16 years in female. So that really is quite drastic when good health is underpinning all of your day-to-day life. That is really the challenge of and what's underpinning all of this work around the West Marsh Community Plan.
So I wanted to include the Marmot principles into this. North East Lincolnshire has been selected and is going through a process to become a Marmot place. And under the Marmot place, we feel that these community plans will help shape what that is, and these can be the blueprints to the Marmot place principles. So on here, you'll see that there's 8 principles. I'm not going to go into a lot of detail into these, but as you can see, they range from giving every child the best start in life, all the way through to environmental health and equity. And what we're going to try and do as we move forward with these plans and as a whole is linking with Lindsay and Chris at the team that are looking into the Marmot place, the public health element, and how it can help strengthen that. And could the community plans be the blueprints and the Marmot wards for the area as well? So that's how I just wanted to link that in there and try to get us all thinking of Marmot, really. And Lauren, I've just found out my teammate Lauren King has met Michael Marmot again this year. I mean, that's twice in 1 year. I said they'll be taking a restraining order out on her next. So why a community-centred approach? So the West Marsh residents understand their challenges and their streets and their community better than anybody else. And it would be really wrong for a community plan to be directed by, say, the healthcare partnership or the council. It really needs to be driven by the people in the community. When they're involved, obviously, when people are involved in the community from conversation to co-design, then people own that plan. And that's what's really important about getting this delivered to make effective change. So for obviously decades, people have been top down and left neighbourhoods feeling ignored and deprived. But the community plans is like listen first and act second. And a lot of what me and Craig and Helen have done at the beginning of this plan is listening. And at first of all, people probably thought, what are we doing? Why are we doing this approach? What's it about? But we wanted to make sure we went with a blank piece of paper and let people talk to us. Instead of having a pre-made survey, instead of having preset questions, we wanted the community to tell us what was their challenges or their positives and what would make a difference and what's missing. So there is a North East Lincolnshire health and wellbeing strategy, and it calls for like shared leadership. It talks about the NHS, councils, voluntary sector, and about delivering to and moving away from delivering to delivering with. And we feel like these plans are doing that. So that's why it is a community-centred approach to all these plans and what we're doing, really.
So the community plan is a resident-led vision for the future of the West Marsh. It's been developed by the West Marsh Forward, the Health and Care Partnership and the Council, but more importantly, it shaped through, as Amy said, conversations with the people who live and work here. The plan will focus on the issues that matter most to the residents and help us work together to influence change, attract funding, and take real action. When we first started the plan, we had 6 main themes, which include heritage, but as conversations continued, it became clear that transport was the major priority for people. So as part of our steering group discussions, we agreed to replace heritage with transport. Heritage has still been underpinned in some of the other categories that we've had and the other themes, but we hope that this has showed how flexible we're being and how seriously we take what the residents have to tell us.
Wasn't it, Craig, that heritage, wasn't the West Marsh called Little Russia?
There was a section of the West Marsh, yes.
called Little Russia, and we found that out through talking to the heritage groups, didn't we? And I thought that was quite fascinating, really. And there's some brilliant pictures and history, isn't there, in the West Marsh? So we are going to like make sure that gets put in there as well, aren't we?
Yes, yes.
So obviously, alongside some of the negative parts to obviously why we've got this funding for deprivation, for health inequalities, there are incredible assets on the West Marsh. Like I say, these are not all negative. Obviously, there's people and communities rooted like West Marsh Forward, the West Marsh Community Centre, the Food Bank, the Baby Bank. We've got the Warrior Women. You know, we've got some excellent organisation. Little Coat School is just a beautiful school to work with, and we'll talk about some of the work we've done with them as well. People are passionate about the West Marsh and they really want to see positive change. You know, there is determined hope and there is growing diversity. We've got a lot of new people to working in the UK. So we've got a lot of Nigerians. There's an amazing Nigerian church and lots of different kind of communities coming out on the West Marsh, which will only make it stronger and give it that extra diversity. And there is untapped talent. So it wasn't all about being negative, this plan. And that's something that we're really quite keen on, and to make sure that we capture all these positives as well.
So we've now completed our first phase of engagement, and we've had over 22 community conversations, meeting with residents, groups, businesses, and attending local events. So far, around 250 people have taken part, generating almost 10,000 words of insight. For this, 6 themes have emerged, and they'll be shaping the main structure of the plan. These are some of the photos that we've taken along our way, and some of my favourites are on the bottom left. We got to meet with Little Coat School with their school council. Here we was drawing our dream street, so what we would want our street to look like, and also pinpointing our favourite places on a map. And then on the top right corner was when me and Amy got to attend the launch event at Grimsby and Bloom for their new community garden.
I think the other picture that just stands out was, for me, the one actually in the East Marsh, but it was when we got to meet the ICON team, so the Independent Commission on Neighbourhoods, and Baroness Hilary Armstrong. And she's the lady in the pink and the kind of navy jacket. So we got to talk to her about housing in the East and the West Marsh. And through the work we've done on the East, we got to invite Craig along to bring the communities together to talk about the housing and the levels of deprivation that are there. But for me, that conversation took place in Grimsby. It's then gone back to the House of Lords. So actually, these plans are making a really big impact in that conversation. And to think that people, instead of us going to London, they came here, that to me was a game changer in that conversation. And for them to really see it and feel it, that's really important as well. So yeah, it's been a really good engagement phase, really good.
So we found that one of our strongest themes we heard was about housing. Resident told us about empty housing, so more than 300 across the area, poor quality rented accommodation, damp, overcrowding, safety concerns. People also talk about fly tipping and the state of alleyway issues, so fly tipping in alleyways, and also the impact that this has on the environment and how just the neighbourhood feels overall. This issue then has major effects on health, safety, and people's pride in the area.
So in regards to environment, the environment of the West Marsh is a bit different, and the actual ward itself is quite boundaried by its environment. So we have the River Freshney in the West Marsh. We've got, I dare I say, the Broken Bridge in the West Marsh that's causing another boundary access to the people and transport issues. And it was felt like a lot of people see persistent fly tipping in alleyways. We know the councillors are working hard on this, but the level of fly tipping, it's really high. We feel, the people feel it's been overflowing of public bins, and they'd like to see more bins and more regular kind of patrols to empty those bins. They feel like there's neglected green spaces and broken glass. And when we spoke to the children at Littlecote School, you know, they were saying that there's lots of rubbish and that they don't feel safe on the parks because there can be different paraphernalia in the parks as well. The River Frishney is described as dirty in some places and overgrown. And we know there's a lot of work going on with that, but imagine how better it could be if we all kind of came together. And I think on that, if I'm right, Craig, a lot of people said things like, you've got the Environment Agency here, you've got the council here, and is it the River Agency as well? There was like 3 different people, isn't there?
There's up to 5 organisations in some places that own different parts of the river, including some privately owned homes that the riverbank is still on their original deeds. So for big fundamental change on the river is such hard work because all them agencies then have to agree.
Yeah. So there's some of the issues on there. It's got obviously an industrial part, the West Marsh. So you've got some of your factories, and there's an old landfill on the West Marsh as well. And there is also, like we said there, some poor communication of authorities. And, you know, we'd like to see that improve. So we're hoping this plan can maybe help with that as well.
So community was another key theme, and this really builds on what we found as when Amy was talking about the key assets of the area is basically the people and the community is in how it's made up. That's not to say that there's not some challenges and things that could be done better from a community focused way. So the first bit is around cultural and family friendly spaces. So family friendly things for groups of people to do, not just the traditional swimming and things like that that's there, but other activities as well. We also spoke quite a lot around existing organisations joining up better and how that'll better meet the needs of the residents in that area. So there are existing organisations that, again, we spoke about in the assets section, but how they can work better together to make a bigger difference to the people that are using their services. Antisocial behaviour and crime. So we spoke a lot about this with residents and also compared it to the data that we as a council hold as well. So although it shows that crime is reducing, there's a big difference in West Marsh between the town centre, so Grimsby town centre, and then the residential areas of West Marsh as well. So we've had to continuously, throughout all of the sections, community being one, transport another one, really look at why there is a difference between what the data's telling us and what people are telling us. And that's why the engagement section of this community plan was so important, that we look deeper than just what the data's telling us, because crime is going down in West Marsh, but not necessarily in the areas that people are living, but more around in Grimsby town centre. We'd also said around the positives of Horizon Youth Zone, although there was some mixed feelings around that. That might just be a case of until it's open and until people are using it and until it's actually seen and felt and it's experienced. So that hopefully that would be a positive. And then the transient population. So this links back to what Craig said when we gave the West Marsh overview around a high proportion of rented properties. And that diminishes the feeling of community. If people are transient and moving in and out, then that kind of reduces that feeling of community. Finally, digital exclusion. So especially for old people, this isn't something that's new or only for West Marsh either. So it's easy just to say people find out about things online now, put it on social media, but we're really clear that that needs to be different, and how and who that we need to be talking about and who that needs to change with. So linking back with community groups and all the organisations working better together, how can we support that?
And there were strong calls for a community notice board in places like the park, different ways of communicating, not just digital. So that's something that we're going to look at as well.
So health and well-being came through as a huge concern. And people told us their struggles to access GP and dentist appointments, and there actually isn't a GP, a doctor's surgery on the West Marsh, and our dentists we have because of the town centre. There isn't any in the residential part of the West Marsh. We also heard about gaps in mental health support, that in the area there's a lot of visible drug use, child obesity, and how also that impact of housing has on health. A lot of residents in the conversations we had did talk about having a local health hub in the West Marsh. We did have conversations around the new diagnostic centre, but how that could be pushed further for the residential side to it. But mainly it was all linking back to the transport barriers, making it all harder, especially for people without cars, to access the services that are there.
So work, there is high levels of worklessness identified across the core communities. And when we spoke to different people, they felt like some of the skills that you need to, say, do real world jobs were not being taught at colleges. And at colleges, people were kind of going towards more different skills and not kind of like work ready and those kind of skills. So that's kind of something to think about. There are limited local job opportunities and residents lacking well-paid, kind of stable employment, gaps in CVs and being ready. So that like kind of employability program and working around that and looking at how we can link in employability with what Ross does at Navigo and other kind of providers. One of the other things which we'll talk about in a minute with Craig will talk about around transport, but just for example, so we all know Franklin College. We all know that that's based very close to the West Marsh. It takes buses all the way around Northeast Lincolnshire and it even takes buses out of our county, but it does not provide one bus to the West Marsh. So when we spoke to a youth group, they said to us, oh, it's easier to go to a factory job than it is to get to college. And that's really, really sad. That does not build aspirations. So that's something that's on our radar as well. And obviously loss of traditional industries, leaving, skill mismatch. And I think, it's great about people wanting to work on the turbines and get that. But then, Orsted do recruit, but they class their local area as 100-mile radius of Grimsby. And when we spoke to them, we actually said to them, do you not ring fence any job roles for, East and West Marsh, considering your head office are in these areas? And they said they couldn't do things like that. So again, it might be worth us revisiting those conversations about how they can ring fence certain specific roles, specifically for young people of Grimsby or adults in Grimsby that want to change their careers.
So transport, as we say, we've touched on this already. So transport was something that we found that needed to be a priority once we'd started engaging with the residents and the local population. Buses are a key issue. So we've touched on it about college already, working, and that's even before we've even mentioned anything around activity and leisure, that sort of thing. So infrequent, expensive, not reliable. That was sort of the general feedback that we had, unfortunately, around getting a bus. And then the routes are a different issue altogether, in that you could often need 2 buses to get back into town and then to actually where that you want to go from the residential areas. Young people report feeling unsafe travelling in the evenings. So again, that's a whole limiting opportunity for them around what they can do, jobs, college and socialising. So we also spoke to some older people around dial-a-ride as well. And again, feedback was similar in that the cost is just too much. We also, again, focused on the disparity between Grimsby Town Centre and West Marsh residential area, because on paper, the data says that West Marsh has excellent transport links, has excellent bus opportunities. And again, that's because Grimsby Town Centre is classed as West Marsh ward. That's not the experience that residents are having. And moving away from buses, other transport, so walking and cycling routes, pavements are poor. Safe crossings for children at school was something that was brought up as well. I always feel nervous about Corporation Bridge at the council. So with just a bit of a warning here as well that lots of people didn't mention Corporation Bridge.
Yeah, they didn't. They didn't.
So, which was a surprise.
They didn't.
And I guess that's because that's in their face day after day. It's something that it's a road that's closed, something that they'd use all the time, where for me, example, that's not in that area, it appears more of an issue when I think, oh, I could have done with going to Sainsbury's or Matalan. That's a one-off, not a everyday occurrence for me. So although Corporation Bridge has caused major disruption, and it's an ongoing issue that we're all well aware of, and needs to be resolved, but there are other issues that have been highlighted greater than Corporation Bridge in this transport section that we're talking about at the moment.
That was very good, Helen.
So lessons learned. So kind of time for reflection and what went well and what we can look back on and how we're going to move forward as well. So moving on from that transport was the flexibility to adapt theme. So that was really important. So not only that it's reflective of what we've been told, but that the community understand that we've really listened and that they've made a difference and a contribution. Some persistence and resilience was needed. So the normal stuff of rearranging sessions and making sure that everything's prepared, making sure that we're insistent on who we want to talk to and making sure that we provide that in a way that meeting their needs, so we go to them. So all of that good practice around engagement, making sure that we're following that. The building lasting relationships is really key. This isn't a snapshot, this isn't a one-off program, this isn't a one-off conversation that we're having. So we want to build lasting relationships with the community, with the residents that have taken part, so that when we're going back to make sure that we've listened and heard correctly and we're reflecting that, and also we want them to be involved in some of these changes and involved in a way that's going to make a difference to their lives as well. And that's really going to come from those lasting relationships, rather than it just to be a one-off survey where they tell us the bad things that are happening and that's the last they hear from us. Where and who to share the plan with to create the biggest impact. So that's kind of, again, my role in the council, making sure that we share that with who it needs to be given to. Amy's role in her organisation similarly, and also the community knowing that it's making a difference and that there's going to be a change as well.
So as a team, we were proud to be one of the first community group local authority partnerships in the country to take part in the NHS system collab training. It's really helped us have an understanding of how systems change actually happens, and it's gave us time to reflect on the purpose and the vision of the plan. During the process of the training, we've been able to look at things like stakeholder mapping, strengths, how we build relationships, and also, more importantly, how we create real influence. So how we get people on board to this change. But most importantly, it's helped us grow stronger as a team. From a personal point of view, I didn't have the foggiest what I was signing up to when I took on as project lead. I was nominated. So this has really given me that opportunity to learn the impact of change and what the bigger picture can be of the community plan.
Do you think we sold it well, Craig? Have we lived up to the expectations, or did we missell you totally?
No, I think it lived up and beyond, actually.
And I think the other thing about this system collab training is open to anybody in our ICB. So if you're thinking of you're doing a project, you can apply for it. The applications are open now, and we're still getting support. We're still getting one-to-one sessions. We're still having that journey with them. And I've got to say, it was one of the best things for the West Marsh because it gave it its own identity. It helped me and Helen again understand how different communities can be, but so close together technically, like east and west on paper. You'd think they'd be the same, but they're completely not. But yeah, it gave us that time. We had like one-to-one sessions with a coach, and we got to really explore our project, well, where we wanted to take it, what we wanted to do. And we've got our last session next week or the week after, I think, with Lorna.
Yeah.
And it's been really good. So I would highly recommend it if anyone's looking at a big project and would like any input. It's run from the Newcastle, I think, Tyneside part of the NHS, but it's brilliant. It's all free as well. It's really, really good. So is this bit me? I can't remember.
It's
So I
me,
think
but you can go ahead, Amy.
Oh no, you go, Helen. Sorry.
No, we'll do it together. So yeah, what's next? So we've done the engagement. We've analysed the results. We're pulling together some of those insights and to get the themes that we've just been talking about. So now it's time to draft the plan. So similarly to what we've just talked about, build on this so that we've got that to share with others. The wider engagement is meaning that we go back out to talk to the people that we've spoke to already. So making sure that who we've engaged with get the full circle so that they are aware, they can see the words that they've spoken, they can see that it's represented, they can see that we've listened and that we're going to do something about it. And as we touched on earlier, identifying the projects and the funding opportunities, that's really a key thing here, is that that's what's going to be the change, that's where the impact's going to be, that's what people are going to feel. And within that is the action plan, so making sure that we have prioritised, that we've listened to what people think are quick wins, what's going to take a bit longer, who do we need around the table, and that plan is then shared, as I say, in the organisations that Amy and I specifically work in, to make sure that there's a bigger system change so that other people are listening and hearing the things that we've heard directly from the residents and the community groups and everybody else that's taken part, to make sure that their voices are making the difference, and it's in a way that's best suited to their needs and not what we can deliver as services. And that continuous involvement from residents and local groups. So that's throughout the whole West Marsh Community Plan, not just at the engagement phase, as I've touched upon it. So making sure that they're part of the action planning, that they're part of the projects, that they're looking at ways of moving forward as well.
Yeah. And so the last slide, sorry, the picture's a bit blurry, but we've just put a little quote on there from Sir Michael Marmot. People's ability to take personal responsibility is shaped by their circumstance, and people cannot take responsibility if they cannot control. So we hope this plan helps people to feel in control, or at least be part of that control. So we would like to say thank you for listening, and please, if you would like to ask us any questions while we're here, we are here to answer any of your questions or thoughts or reflections, really. Hi, Gaynor. Hello.
Hello. Just a couple of things I've been just jotting down as you've been talking. So, Corporation Bridge first. I don't think it'll be a big deal to people so much in the West Marsh, because I think probably a fewer of them are car owners.
Mhm.
And so that, I think that's why you're probably not getting that noise. GP surgeries, there's no GP surgeries in Haverstow ward either. Unfortunately, they're not unique, and I think it's part of it is about managing expectations, because we'd all want something on our doorstep or across the road, but it's not going to happen in reality, is it? Unfortunately. Having said that, we know that there are large health inequalities, and similar to other places, and we really need to be addressing those, and absolutely agree there. Also, what did you say about the crime figures? Was it you, Craig, or Helen, that there were sorry, I sort of missed a bit of that slide.
Yeah, so crime figures show that there's been a reduction in crime in West Marsh Ward, but when you look deeper into that, the crime has reduced in Grimsby Town Centre specifically, and that's part of West Marsh Ward.
Yeah, so from January 23 until February 24, there were 323 crimes reported in the West Marsh per 1,000 of the population, and that's from police.uk.org. So you will get a higher proportion of crime in there because of Freshney Place, and if you look at where it says about the majority of the crime happening in West Marsh, and the area to avoid is around the old marketplace, and that's for shoplifting, assault, sexual assault, etc. So it'd be really interesting to see what crimes there are in West Marsh, I think anyway, what they would be, or is it people's perceptions
It's a
of
bit of
crime?
both, yeah. So we also link up with the Joint Strategic Intelligence Assessment. So that's kind of, we rename it as a crime survey, and that really does highlight the difference between perception of crime and actual victims of crime as well, because that's exactly the case. It's whether somebody feels unsafe or whether they've had an experience that has caused them to be unsafe. Yeah, exactly right.
Yeah, if you go around and do a survey on Halloween and ask people, do you feel safe in your house at night in the dark, you're gonna get more people saying no than if you did it on the 30th of June.
Yeah.
So I think it's all about that as well.
And there's such wider implications of that. So the media plays a part in that, and the news and all of that, all of the other stuff that we're all quite familiar with around what influences perception of crime as well. And it's not just the fact if you've been a victim of that crime, it's that, like I say, the other stuff as well of hearsay and media and all of that other stuff as well.
Yeah. Okay, great, thank you.
Thank you.
Sorry, Gaynor. Craig, just to come in on the crime, we spoke to Kerry Leanan, didn't we? PCSO Kerry, and also Becky, and also the police people attend the West Marsh Forward, don't they, as well? And I think it is about a little bit. Sorry,
are they from Hamilton Street police station? Are they the community ones from Hamilton Street, or is it
Kerry's town centre? Kerry is the town centre police office, PCSO. And so is they're both PCSOs for West Marsh, though, aren't they?
Yeah, Kerry's town centre, where Becky's residential.
Yeah, I just wondered where they were based, whether there were community teams based in Hamilton Street or whether they're at Victoria Street. But it's immaterial anyway. I'm just interested.
But I think what was interesting was obviously Kerry was explaining to us that, you know, there's been a lot of money from the government to put in a lot of resources into the town centre, but that isn't felt in the streets, so to speak. So behind the town centre, what I call the residential part of the West Marsh. And it was spoke about quite highly, wasn't it? Crime, drug use, those kind of things. But I didn't know if there was any insights, Craig, just because I know you had them come to your meeting, didn't you, last week?
Yes, as part of our West Marsh Forward, we get a report on the crime log. So those calls that have been made, and that is separated the best that Becky can into residential and town centre. And those numbers vary drastically, especially as you said, this time of year, then figures go up drastically. But what we have been told that if we compare those to the actual crime figures, it will change because of the funding that's going into the town centre. Those days of action automatically lift the crime figures where they find drugs, they find weapons, whatever it may be. So we've got a drastic change and differences in numbers that really they show us a lot of different things, but not really what the residents see and feel.
So I just wanted to come in there as well and talk. You said about obviously GP and Haverstow Ward and different things, and I completely get that. But equally, West and East Marsh have the highest levels of health inequalities, and also they have the lowest levels of car ownership. So if we're thinking of a mum on, say, you know, Gilby Road that's got a poorly child that has to walk to Freshney Green because she can't get a bus in the rain, these are the real issues that we're seeing on the West and the East Marsh, where somebody as a mum, maybe on Haverstow, not, you know, might have a car to put the child in to take him to the GP.
Yeah, I'm not saying
so
for a
I think
second
it's,
that
I know, I'm just,
yeah, it's a completely different demographic. But I just think sometimes we need to be careful that we're not raising people's expectations that we can provide that, because it's not going to happen well, certainly not overnight, is it?
No, no. But
And I
what we
think
need to look, oh,
sorry, Amy.
all I was going to say is I think we need to look at better transport that we can
Definitely, yeah.
influence. You know, that's got to be part of it.
Mhm.
And also, can we look at something like Adam's been doing in Immingham, where we get a family hub and have a GP in the West Marsh family hub? They're the kind of things that we could look at and how this plan could maybe help shape that. So I completely agree. And even Waltham, I found out Waltham doesn't have a GP practice.
Mm.
And when we look at older people and how they reach their GP and all of that, so I agree, but I think it's about how we then get people to them GPs as healthcare providers as well.
Yeah, thanks, Amy.
Thank you.
Yeah,
Thank you.
it was those two things, Amy, that you said. It feeds back into making sure that there is good public transport links if they haven't got those public facilities, but then also that raising expectations, it's really key that's why those lasting relationships, and it's not just a one-off survey. That's why it allows the conversation to be a bit more nuanced, with that there is an understanding and that they're part of those prioritizing stages, and that the community's part of that understanding, and that it's not just a one-off thing that they've read and that they've commented on, that they can be part of these conversations and have a bigger understanding around some of those issues. And that's only going to come across from it being a developmental process rather than a one-off.
One last point, I think, with regard to the transport, some work was done a while ago, and this was before lockdown, with the councillors on public transport for people going to factories to work, especially when it was, you know, later shifts or early shifts in the morning, getting backwards and forwards. So it has been raised in the past.
It has,
and I think it's perhaps something that they could pick up again if they're not already doing it.
Yeah, definitely.
Brilliant. We lost Craig. I know it's Craig, so I'll email Craig and just make sure he's okay. But Mike, did you want to come in?
More to Helen than anybody else, but because she's within the council, as I am. Is there a connection with, or will there be a connection with, the master plan and then the movement strategy?
Yeah, both. So we've got the transport hub development as well as Grimsby Town Centre master plan as well. So and as I say, that's part of the partnership working, and the positives of that, in that making sure that there is a link, and a close link in that. So as I've already mentioned, the crime survey as well, for example. So all of the different things that needs to be linked together, that's kind of all of our role, I guess, and all of our responsibility to try and join up some of those dots, as we say, don't we? Making sure that that's happening.
Yeah. It just that I've been brought into that now, as from public health point of view, in relation to all the stuff I cover in terms of wider determinants and healthy place. So, because all the aspects that you covered in terms of the plan, as has happened with the other plan, all relate to population level health.
Yeah, exactly.
That's, you can see that thread throughout the whole thing.
And as you said, similarly in East Marsh as well, which we've already done as well.
Yeah. So I was just asking the question because there's so much going on. There is for me anyway. So that so it was just making sure, like you say, joining the dots up. So yeah, okay. Thank you very much.
Yeah, thank you.
Thanks, Mike. Adam.
Hi everyone, hope you're all well. I've had my camera off because I've been eating and stuff, Amy. So just to kind of bring everything all together as well, really. Obviously, there's the National Neighbourhood Implementation Programme, but then there's the whole place-based approach to neighbourhood health, which fits into all of this work, and how we align things like pride in place, MAMA principles, etc., so that everything works together. I'm sure Mike's going to hear soon about attending a delivery group thing, Mike. Just a little heads up for you there. But what I would say is it links into some of the conversation on with how people access health and services, or how they get to health services. There's an element to neighbourhood health over the next year, 18 months, if not longer, around neighbourhood health centres as well, and what they might look like and feel like, and a push around community engagement for those. So I guess it's just to bring it to the forefront, really, people to have that in their minds when we're thinking about what we're doing, and how we're bringing a little bit of community engagement plan together with the help of Amy to think about what we do with that across North East Links. But yeah, just to bring that to the front now, and I'll probably be chewing the ears of some of you on this call at the same time, I guess.
Real. Thanks, Adam. That'd be great. Chris, you've sent me the report, which is fab. Can I share that with Gaynor and others that might be interested in that as well?
I assume so. We would share it at the forward group, so why not?
It's not protectively marked.
Yeah.
It says that on there. So just so you
We're
know, so
told to
Chris,
share it with the forward group, so it's just an extension. So go for it.
so Chris has just sent me the West Marsh update for October and November from the police, so I can send that through. Looks quite interesting, really. Interesting. Yeah. Different. Looks like the highest rate is which is sad, is violent assaults, really. But I'll send that through anyway, so people can have a look on there. And thank you, everyone, for giving the time to listen to the West Marsh Community Plan. It will keep going. We're looking forward to get it into print next. That's our next big milestone, I think, for this, and getting it back out there. And then looking at some projects to deliver as well, and seeing if we can match fund anywhere. But yeah, unless anyone's got any more comments, questions to share, then everyone can get some time back. Oh, Mike, go for it. Go for it, Mike.
So very quickly, just obviously this is a starter. Will you keep us all involved?
Yep, definitely. As much as residents are wanting to be involved, definitely for partners as well. That's the plan. And however you want us to do that, if you want emails or to be part of a meeting going forward, then let us know how you want to be involved. Is how's best for you, and we can do that.
Anything and everything, as long as I don't get named for doing something while I'm not there.
Oh, I can't promise that.
No.
Once you're in, you're in.
To Mike. But that was the other thing.
And Craig, you're looking a lot better. I just have to say, you're looking. Having been ill, you're looking a lot better.
But honestly, that was the other thing, Mike. People, because West Marsh did a brilliant newsletter, and unfortunately, the funding kind of stopped for that. People really want that back, so can we use this for that and to share information as well? There was a lot of call for, like I say, notice boards, newsletters. So where we think everything's going digital, people want tangible things in their hand as well. So I think we need to keep an eye on that and how we communicate that. But one of the other things we're doing on the East, which I've spoken to Craig about, and it'll be up to the steering groups. It's not all down to me and Craig, but we're posting out the community plan to every home in the East Marsh. And that might be something, again, that we want to do with the West, if the steering group then supports that as well. So we will see. Watch this space. But yeah, thank you ever so much, and have a lovely rest of your day. Thank you very much. See you all soon.
Thanks. Bye.
Bye. Bye, 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 bye.
And Immingham Amy, they're talking about doing the same thing, posting it out.
Awesome.